Primary health care offers many preventative programs for patients with mental illnesses. One good thing about primary health care is that we provide an interactive model. This means that all services are given on-site, so no patient needs to go to a different clinic in order to get the care they need. The two main healthcare providers you will be working with are the behavioral health consultant and the nurse care manager. The main goals of the behavioral health consultant is to recognize and treat mental illnesses, help patients maintain their lives in a healthy way. They will also help patients find the help they need and where to go to get the best attention. The nurse care manager maintains patient documents, does the physical exams, creates health plans for the patient to maintain, and then also educates the patient and the family. The majority of the cases you will see involve drugs and alcohol abuse, depression, anxiety, and grief. Most patients suffer from alcohol abuse and drugs. The great thing about these problems is that everyone entering the clinic will get screened for drugs and depression, and then based off of those results, the patients will be referred to the best healthcare provider. Patients you will encounter day to day include a large Hispanic population and refugees. The Spanish men typically drink more alcohol than other races because drinking is a rite of passage. In our location, the refugees do not drink as much. There will be a cultural shock because they don't understand the Western medicine, so when helping counsel, you must be clear in the information given.
At primary health care, our number one priority is to provide the best possible health care to every patient who enters our door. Our specific PHC location is aimed towards providing various healthcare services to refugees and Spanish-speaking individuals. We experience many diverse cultures at our clinic, so it is important that one is kind and respectful when talking to and interacting with patients. We welcome patients from various backgrounds, colors, ages, education levels, sexual orientations, and even undocumented and uninsured individuals. Our employees do not discriminate, and we do not turn anyone away. Many refugees who visit our clinic do not understand Western culture nor Western medical practices. In these situations, it is important to do what you can in order to respect the patient without affecting the quality of care that the patient receives. It is important to maintain communication and respect between the employees of PHC and our patients. For example, many Hispanic patients do not understand the importance of preventative medicine and going to regular checkups and refilling prescriptions even if they feel healthy. In these situations, it is important to communicate to patients the importance of prevention and the resources that they have available to them at the clinic in order to stay diligent with their healthcare maintenance. The bottom line is to respect everyone who walks through our doors and make their good health and well-being our number one priority. The most common mental health problems amongst our refugees and Spanish-speaking patients are depression, anxiety, and grief. Many of our patients have been forced to flee their countries due to war and persecution. Some have been forced to leave behind family members for which they cannot provide care to because they are unable to go back to their home countries due to being undocumented. Often undocumented patients have deep feelings of guilt because they cannot be at home with sick relatives or attend important family events in their home countries such as weddings, birthdays, and funerals. This guilt transcends into depression and anxiety and causes the patient trouble in other areas of their lives, affecting their relationships, family lives, and jobs. Patients who have left war-torn areas suffer from PTSD, anxiety, and are often victims of sexual abuse and physical abuse. It is important that these patients know that PHC is a reliable place where they can get help for their mental health-related issues. Respect is key in fostering relationships and communication with these patients in order to provide them with the best possible health care.
Stigma against mental health comes from all parts of the world. In the United States, there's still a lot of stigma against what mental health is and the people receiving treatment. This stigma is still present with the population that you will be treating here at primary health care. Remember to keep in mind that the individuals that you will be helping may not have any education on what mental health is. If they do, it may be limited and misinterpreted by social stigmas. Additionally, the patient may not want to admit to having a mental illness, or, sometimes, their mental illness will come across in the form of a physical pain, such as a stomach ache. The patient may not know the difference or may be afraid to tell you or what he or she is feeling. A main reason that patients are afraid to talk about their condition is fear of gossip. It is extremely important to educate the patient on confidentiality and HIPAA laws. Reinforce that anything said between the patient and the provider is strictly confidential and that even the interpreters are bound by confidentiality laws. For interpreters, even after confidentiality has been explained, there will be some individuals who would prefer a phone interpreter. Do not take offense to this. Respect the wishes of the patient and do not let it affect the patient's relationship with the clinic. It is also important to remember that the population you are going to be working with mainly comes from other parts of the world. Because of this, there are cultural myths that you need to be aware of. Some of your patients may have a fear of taking too many medications because they believe or have heard that taking too many will poison their organs. There can also be many concerns about side effects. If the patient is concerned, please take the time to explain side effects and how they will not last forever. Particularly in mental health, it is also important to educate the patient that they will most likely not be on their medication forever. The medication has to have time to build up in the patient's system as well, so they won't see changes right away. Please take the time to educate your patients on how their medication works and its importance to their health. Other cultural differences you may come across include the patient's symptoms having strange origins. The patient may complain of their kidneys hurting and point to somewhere on their body nowhere near their kidneys. This stems from a lack of education about health. You may also treat patients who give the reasoning for their illness to cultural rituals. Let the patient explain and be respectful before approaching with another possible explanation for the illness. It is also important to know that many cultures have a belief in a hot and cold body when it comes to health. Certain illnesses are usually associated with a hot or cold body, and great emphasis can be placed on this belief to where people use specific treatments to try and get rid of the illness. Lastly, many of the patients you will be seeing place great importance on family. Many times you will see a patient who has brought a member of his or her family. It is very important to some people to have approval from the family before making a decision about their medical care. This can sometimes result in thinking about the greater good of the family and not the patient. Be respectful, but also encourage the patient to go through with the treatment if it regards a potentially serious health problem. As you work with your patients, make sure to be reassuring and then their medication will work. Medications with mental health can take a long time to show change. It is important to be an advocate for your patient and encourage them to stay positive as they go through this new change in their life. Your treatment will work and they will feel better.
While prevention, treatment, and healing work, you will have to try a little harder than you would with typical patients to make sure they follow through with various things. Because most of the patients you will encounter day to day include refugees and people who are not used to Western-style medicine, you will have to help persuade the patients to stick with things such as taking medications, refilling their pharmacy prescriptions, going through with procedures, and coming to their follow-up appointments. A lot of times, patients that aren't used to Western-style medicine or patients who have a mental illness think that once they start to get better from the medicine, they don't need to go get refills because they are already cured. This unfortunately is not the case. The patients need to continuously take the medicine they are prescribed to be fully recovered. Another problem that has been seen is the patients won't go refill their medicine. A lot of times they will get the first prescription, but once they are done with that bottle, they think they are completely finished, even if they still have 5 more refills. In most cases, they don't understand how the system works. In order to fully recover, they need to take the medication and take the whole amount, which a lot of times includes refills. Patients may also need a little extra push to follow through with certain procedures. While we don't ever want to force a patient to have a procedure they are not comfortable with, we do want to make sure they understand the benefits certain procedures may have for their well-being. Being able to outline the benefits and provide your expertise as the doctor will be able to help the patients form an educated decision. Along with all of the previous listed items, patients will also need persuasion to continue to come back for follow-up appointments. Just as in the pharmacy refill scenario, a lot of times they believe that if they are feeling better, they do not need to return. However, a patient can gain so much from a follow-up appointment along with their providers. Stressing the importance of follow-up appointments will most likely have a positive impact on patients. Other things that can be done are follow-up reminders such as letters, phone calls, and emails. Barriers that patients may face are the fact that they may not have a car, money, or insurance. All of this makes it more difficult for patients to be able to accomplish all of the previous listed tasks, but educating the patients about the insurance program that is offered through primary health care is one way to make patients feel more at ease. All of the items listed out here will help the patients continue with their recovery in a positive manner. Thank you for watching.